Dr. Brisavonic, sometimes you see patients who may have had surgery maybe elsewhere, and they're coming to you to get something fixed. So how often do you see this where a patient needs something redone?
I'd say about half of what I do. Half of what I do are revisions. So these are patients who have already had an operation and for one of multiple reasons are still suffering.
And infections, is this also one of the things that you have to correct after surgery as well?
Infections less so. So
Okay.
I've been lucky. I've been in practice now for, this is my 8th year, and I've had no infections. I do a bunch of things a little different, and there's some great research to back up these innovative techniques that minimize the risk of infection. But even though I've been lucky, I talk to every single patient about getting an infection.
Right.
And I tell them that if you get an infection, your chances are 100%, you know, and then it doesn't matter that it's a very unlikely possibility.
Right.
In surgery, if an infection happens, it has to be addressed early. As soon as you cross that 2-3 week line and the patient's wound continues to drain, according to textbook, you don't wait, you don't put the patient on antibiotics, you take him back to surgery, you open the wound, you wash it real well.
So it's back to a surgery?
Oh, absolutely.
Okay.
You make sure to rinse the incision, get all the infection out, and then you close it real nice and neat and tight, and then you watch it like a hawk while you're giving patients an antibiotic.
Right.
And especially an antibiotic targeted for their individual infection.